Hello, and welcome to the Ask Nurse Linda webinar. I'm Nurse Linda, and I am a lightly pigmented skinned woman with brown hair that goes down to my shoulders. I have on pink rimmed glasses. They're kind of flesh tone, I guess, more. And today I have on a gray cardigan sweater because it is the warmest piece of clothing that I own. So, first of all, I'd like to say welcome, and I hope wherever you are that you're warm and you're safe, that you have electricity and you have all the things that you need. I know there's still some places in our country, I think, that still have some outages, and so that can be really rough. Now, we've been through this emergency, this weather emergency, and so I hope you've kind of tested your systems a little bit to see, if your power went out. Did somebody come from the emergency medical services to check on you? If not, you probably want to call them and tell them that you know what your ability levels are because they keep that all on file in their computer. It's totally private, so you don't have to worry about, somebody finding out information. But in different areas, it's not in every area, but in different parts, different cities, different areas of the country, you can contact them, and a lot of them will bring like a lockbox to your house where you can put an extra key in there with a code. In many places, these are free. Not everywhere. I don't want to speak for everyone because I don't know every town and city in the United States or in the world. But some places will give these little lock boxes to you for free, or what you can put a key in there. They might have a code in there, so that they will know the code. So if you're in the house and they can't get in, they have to break down a door or something really destructive to get in. So be sure and see if that service is available, but be sure and tell them, especially if you're requiring power for your ventilator, for your electric wheelchair, for your electric hospital bed, whatever that you might use that generates electricity, because they will come and either move you to a safe place where you have access to what you need, or they will come and get your service up quicker because that you need this power to exist. And so be sure and let them know what's going on. You can do it through the fire department, you can do it through EMS, the police. Sometimes there's a central, you tell one and then they all know, but it can be very, very helpful. Something I was thinking about during this uh, huge storm, and I was thinking about supplies. So I know I didn't get mail or packages, although I don't think I had anything on order anyway, but I didn't get anything during the storm. And of course, it was delayed. So if you're waiting for your catheter supply to come and you're uh, without power, or you're not able to contact anyone, and you've got a week and your catheters are gone, find out what mechanisms are available to you. So you might want to call the company and say, we had the power out. I couldn't get my supplies. And if it's an area that has a power outage, will you automatically renew it? Will it automatically come? It usually does anyway, but just, you think about all these little things that you don't know. You're so dependent on services until the services aren't there. So, check into how all that works, your medication, if you're housebound, because boy, I sure was for quite a few days. And if you're housebound and you can't go to the pharmacy and get your medicine, how will that happen? What, is there service where they'll bring it to your house? Just all these kinds of things are just good. And think about, if you're in your home and your family is someplace else and we have a storm like this and they can't get to where you are, how will all of that work and where will you meet up? And a lot of people uh, have services where they go through their emergency plan and they're thinking about what they're doing about different things. And they say, okay, if there's a fire, we'll all meet at the mailbox or we'll meet at the mailbox down the street. So we'll be away from the fires. People think about, and then they don't think about, okay, now our house burned down. What are we going to do? So think about long term. Okay, if this happens, what do I need to do today? What do I need to do tomorrow? What will I need to do next week? so that you'll be sure that you have everything you need. And we have an emergency preparedness booklet. It's one of those booklets that I tell everybody to get through the Reeve Foundation. It's really quite excellent because it will give you a lot of prompts to think about a lot of things that maybe you didn't think about. It's what I call one of those books, and you'll see it's there in the chat box. It's one of those books where I like to say it's a book that you need to read and enjoy, learn from, but hope you never need it. That's exactly what you need to think about. There's also a booklet about being a victim of a crime, which is another one that's a really good booklet to have. Again, I call it one of those books to have, to read, to know what's in it, and hope you never need it because we want you to stay safe at all times. And so we want everybody to be safe. But, when you have needs that are kind of outside, a lot of people don't know people with paralysis, so they don't know what the needs are. And so it's just kind of good that, you have to be the captain of your ship at all times. So we do have quite a few questions. You can type your questions into the question and answer box as we go along as well. And I'm going to go ahead and go through some of the pre-submitted questions just so you can kind of know what's going on. There's somebody who wrote in they're C4 quadriplegic and just hit their 1 year anniversary. And I want to say congratulations because I think that people who survive these devastating injuries, I don't need to say this, kind of a dumb thing to say, but it's hard. It's just really hard. And so, reaching that 1 year mark is quite a milestone. And I consider everybody with paralysis heroes because, you're really working hard to do what you need to do. It's quite an adjustment for you, for your family, for your friends. But, if you keep going with it, you can find a very satisfying life. And I'm going to say one more promo for the Reeve Foundation. We have that peer mentoring program. If you find you're struggling, you're seeing a counselor or a therapist, and you're struggling, be sure and consider what your what your world is like, and you might want to consider joining the peer mentor program at the Reeve Foundation because they will connect you with somebody who's similar to you going through what you're going through. Now, you can't always match up perfectly, but they'll try to pick somebody if they have somebody locally in your area. And I've talked to so many people that have been involved in this and have just found so much relatable information. The peer mentor that you will be attached to is a person who has been educated in being a peer mentor. So they're not going to just sit there and say, "Oh, I know, that's so sad. Now let me tell you my story." They're really interested in you, hearing about your concerns. They'll give you some different suggestions. They talk to a lot of people. They might say, "This is something that I have tried. It may or may not work for you." They're not going to be telling you what to do, but they're going to be telling you, "This is something I heard about somebody else did. This is something that I was reading about. It might be." And they'll kind of talk you through these different situations. It's always up to you to choose what you choose to do. That is your decision, but they'll give you some ideas that maybe you didn't think about. If you have somebody local, I know it's been very helpful for people if they have somebody in their peer mentor, if it happens to be someone in their area, and you're not able to find a doctor that you feel is meeting all your healthcare needs. They can suggest a doctor that somebody went to, or you might want to try this one. Again, it may or may not work out for you, but they give you different options and things to think about. You might be able to help the peer mentor and say, "Hey, I ran into this problem. This is what I did." They'll put that in their peer mentor memory bank, and you might help somebody else through that same peer mentor. If you want to be a peer mentor, you can certainly volunteer to do that. They have family members who will be a peer mentor to a family member. So if you're having a struggle with somebody, sometimes in families, it can be hard finding your rhythm together because your family member might want to overdo for you. Or, and you think, "Well, I can really do this myself," or "I want to make my own decisions. I don't want you to go to the doctor and tell the doctor what's wrong with me. I can tell the doctor what's wrong with me." And, sometimes working through those issues, you have to be just upfront. and just say it. It's not meant to hurt your feelings. You have to be kind about it. Instead of saying, "Oh, I don't like the way you do that," but approach them and say, I'm kind of thinking I'm ready to talk to the doctor myself today. I think I'd like to try that. Think about how you work, and the peer mentor can help you work through that, those kind of things. So I just like to bring that up because so many people have found such success with that. Now, if it turns out that you and your peer mentor don't really hit it off, and it sometimes happens with everybody. Not everybody's made to be best friends with everybody else in the world. We all have differences, or whatever. Sometimes we just don't gel together. You can talk to the peer mentor people at the Reeve Foundation, and they'll reassign you. It's no hard feelings. These things just happen. So, we want you to give it a go, but, just, know that you always have options. Okay, so we do have a question in here about somebody had to put a syringeal pleural shunt 2 years ago. They had a large syrinx. I was going to say, that's because you had a syrinx. Okay, how often do I need to be checked by a neurosurgeon? Once a year. Well, that will be up to your neurosurgeon to determine. Sometimes they do the post-operative follow-up and then they refer you back to your regular doctor, because if you start having losing any kind of function, then you know that that could be something wrong with the shunt. So once those shunts are in and they're draining the syrinx, you should maintain a stable condition. So neurosurgeons will do it different ways. Sometimes they'll refer it back to your original doctor. If you feel like you want to continue your checkups with the neurosurgeon, you can ask if you could be seen yearly. You could be ask them, how often do you think I need to be seen? Because, they might feel, I can't say how they're going to respond, but they might feel like they've corrected the problem and there should be no further problems. And so once you have that shunt corrected, there should not be a further problem. However, things happen. We all know that. People with paralysis know that better than just about anybody else in the world. So things do happen. And so I know for your comfort level, you might want to have that. And so, talk to them and just ask them about that. But nothing should happen to it, but things happen. So, if you have any increase in your decrease in your function, increase in your inability to do something, but decrease in your function. And I just want to add, because I thank you for this question, I just want to add separately, on a separate note, is that not too long ago, somebody wrote into me, and I had said something online, and this is absolutely true. Once you have a spinal cord injury, you usually do not have progression. It does not get worse. Now, things happen, like you get a syrinx. For every rule of medicine, there's except for this case. So I wanted to bring that up because I had said that. Now, if you have paralysis from other things, like a stroke, your stroke could progress. If you have paralysis from neurological diseases like MS or Parkinson's or uh, ALS, those kind of things, those are progressive diseases. And so you might have progression. But with spinal cord injury, it hardly ever progresses. And so I want people to know that, because this person wrote to me and said, I've been living every day of my life waiting and wondering when the progression is going to come. And then you said it's not going to come, and it turned my life around. And I was just like, oh my gosh, I never heard of somebody waiting for their spinal cord injury to get worse. So it worries me that perhaps we're not educating people with spinal cord injury in that regard. I mean, we do this when we work in paralysis. We know, oh, spinal cord injury. Well, this is the way it is. Now, you can progress and get return of function, depending on what your injury is. Some people have incomplete injuries and they'll have some return of functions, which is always a good thing. Some people are doing different therapies and are getting different abilities, and so that's a wonderful thing. not everything works for everybody, so it's good to keep up with what's going on and then you'll know. So back to the neurosurgeon question is be sure and ask them about that. And the next question is about UTIs, and I have some questions that were written in, so we're going to talk about this for a little while. Any thoughts on cranberry and D-mannose supplement for bladder management and UTIs? I do have some thoughts about it. Works wonderfully for some people. It doesn't work at all for other people. It's the way our bodies respond to different things. Now, back in the day, we used to give everybody cranberry juice and apple juice because um, that would change the pH of the urine. And sure enough, when we test it, the urine would be more acidic. But those both have so much sugar in them that diabetes is a problem with paralysis. You can get secondary type 2 diabetes as a secondary complication from paralysis because of not moving your body enough. And where sugar gets metabolized the most is in those big muscles in the thigh. Now it gets metabolized all through your body, but when you're up walking and you're exercising, the muscles in your legs, especially in your thighs, then that really metabolizes a lot of sugar. Now, if you're drinking, like cranberry juice all day long, that's just too much sugar to put in yourself all the time. So people will say, oh, well, I switched to the sugar free. But guess what? The substance that makes a drink sweet, that is not sugar, the product that they put in there to make drinks sweet works kind of the same as sugar in your body and the metabolism. So we always tell you to avoid sugar and avoid artificial sugars because of that problem. But there's some people who do the D-mannose and they find it very, very good for warding off infections. There are other people who don't. So you need to talk to your healthcare professional because you don't want to try all these things just to see how they work because that's just like throwing money out if it's something that's not good for your particular body needs because we're all individuals, we all operate a little bit differently. So talk to your healthcare professional, and if they say, well, yeah, go ahead and try that, see how it works, then maybe consider it. There's so many products when you go on the internet. Oh, here this works, oh this works, oh that works. And it all depends on what kind of bacteria you're susceptible to. That's why we always have you do the urinalysis to see if you have an infection, because there are a lot of things that mimic infections. And then we always have you after the urinalysis that says, yes, you have an infection. No, you don't have an infection. Then there's the culture and sensitivity, and that tells you exactly what bacteria is in your body. So if you take an antibiotic, you want to take the antibiotic that's going to kill that particular infection that you have. So not all antibiotics kill all different kinds of infection. Now, there are antibiotics are rated in what's called generation. First generation antibiotics only treat a few different kinds of infections. Those are the best ones to take once you know what your infection is. If you go up to like a fourth generation antibiotic, it's going to treat a lot of different infections, but it's also going to raise your resistance over time to all of those infections. And now we're seeing this phenomenon of what's called super infections. So there's bacteria that cannot be treated by antibiotics. And we don't want you to get in that category because there's not a lot you can do about that then. So you always want to you need to treat the infection and you need to start go low and go slow and take the entire bottle. So some people say, okay, I got this bottle for 7 days or 10 days or maybe longer of antibiotics, but oh, I feel better after 2 or 3 days. So I'm going to save this antibiotic for when this comes up again. When the antibiotic's prescribed, it's prescribed for a certain length of time because even though you feel better, that infection has not been killed in your body. It's still in there. The reason why they prescribe antibiotics for so many days, and it varies depending on what your infection is. That's why, some days it's 5 days. Sometimes it's 5 days. Sometimes it's 10 days. Sometimes it's 21 days. It depends on what the infection is because you have to take that antibiotic for the entire time to kill the antibiotic, to kill the infection. So those are very important things. Another question about urinary tract infection is how can I prevent kidney stones and UTIs? Um, so, this is the bane of our existence, right? How can we do this? Well, kidney stones can be helped by a variety of different things. So if you're not doing standing or if you're not moving the bones in your body, because the stones come from usually started in the bones and calcium's leach from the bones and you get osteoporosis, but you can also get kidney stones, or sometimes it just the urine crystallizes in there. So you need to keep your urinary tract flushed. So you need to drink water. Water is the best. You can have a cup of coffee, you can have an occasional whatever kind of drink you want to drink. But be very careful about the sugar. The UTI bacteria thrives on sugar. So the more sweet you eat, the more sugared drinks, the more artificially sweet sugared drinks, all those things are going to help perpetuate urinary tract infections. Water is the best. Now, the downside of that is most people are on a bladder management program and they can only intake so much water at a time. So that can be a difficult time to maintain water. But when you have the opportunity, flush your system with water to whatever your bladder program management is. Um, okay, somebody wanted to know. Um, they've been having urinary incontinence for no reason. They're a male, and they were wondering if a pubic catheter could help this. Well, usually with urinary incontinence, this has come on, um, has just come on for no rhyme or reason, but there is a rhyme or reason to it. And what happens with paralysis, sometimes, not in everyone, but sometimes what happens, and would suspect this might be your situation, the sphincter of the bladder and the bladder muscle gets out of sync with each other. So what will happen is the sphincter that holds the urine in the bladder can get too tight or it can get too loose. And the muscle in the bladder can squeeze too hard or can squeeze not hard enough. So there's all these pressure balances that need to occur to maintain continence. So you need to go and have a urodynamic test, find out where the problem is, and then they can treat that. There are different treatments. Some of it's medication. I know some people don't like medication, but if it makes a difference, you might want to consider that. If you're not on a bladder management program, where you're doing catheterization to keep your bladder empty, you might be having some problems with that. Sometimes people without paralysis will have urinary retention problems. And it's the pressures in the bladder and the sphincter have come out of sync. You just need to put that back in sync and it bada bing, bada boom, it's better. So, there's sometimes on occasion, sometimes people get on too much medication and then the bladder tightens up and then they can't void. And then you have to go and have a catheter to drain the bladder and then they cut down on the medication. But people are so experienced and the people who prescribed are so educated in doing this, they will get you on the right amount of medication. They'll probably start you out low on a low dose and maybe build you up to a higher dose till they get what's right for you. And then once you're not incontinent anymore, they won't up it anymore. So you know that will be safe. So another way on how to prevent bladder infections is to move your body, that parts of your body that are paralyzed. And, it's really hard. People leave the rehab hospital, and the first thing they do is they give up their stretches. It's so time consuming. It's hard to lift your own body part. If you have to do it yourself and you can lift your legs with your arms and do the range of motion, there are things that you can buy, which is like they're called loops, Loops. leg loops. And they're a piece like a piece of I don't even know what to call it. It's like the same thing like a transfer belt is made out of. And they Velcro around your legs. And then there's a loop that goes on to the part that Velcros around your leg. So you can slip your arm into that loop and you can exercise your leg with your arm. If you're not able to reach down and pick up your leg, you can do it with your feet, you can do it with your calf. Any kind of movement that you can give your body. If you can't do it to yourself, you need to find somebody to do it for you. And you need to do it a couple of times a day because use, I've heard me talk about this. I use the James Bond method of bladder care. And that's, he would always orders martini. I want it shaken, not stirred. Well, you want to shake your bladder. And the way you're going to shake your bladder is to do your pressure releases to move your body. So I'm using my arms to raise my body. Use your wheelchair. If you have a tilting wheelchair to move your body, you're shaking your bladder. Do your leg exercises. Provide that input to your body that's been paralyzed. Your body craves it. You're not getting the message that your body craves movement, but it's craving it. It can prevent contractures. It can help with your blood flow. It can help reduce edema in your legs. Does all kinds of things. Two of the things that people don't relate to moving their legs are it shakes your bladder and it also exercises your abdominal muscles so that it helps your bowel program be a little bit better. Well, that's two bonuses that makes it worth moving those legs. So keep exercising and moving. You want to keep your body in shape. We are on the crescent of so many things coming out and so many things that have come out that have changed people's lives with paralysis. So we have so many things on the platform. So you want to keep your body in shape. If you want to take advantage of some of this new type of equipment, new things that are going on, you want to keep your body in shape. You don't want to go and say, well, you can't use a standing frame, which you should get a standing frame if you don't have one. Most insurance cover it. But if you have a contracture or if you have a blood clot, a deep vein thrombosis, if you have osteoporosis, you can't use the standing frame. And the standing frame will help with maintaining the calcium in your bones. Again, when you're standing up, you're putting different pressure on your abdomen. So that's going to help bowel and bladder again. It's going to keep your skin healthy, just, everything. So most insurance companies cover that standing frame. You can get some that have like skiing poles on it that will move your legs while you're standing. That's kind of cool. If you have arm function, that gives you that exercise in your legs. And it not only does it, people stretch and they pull their bodies, they usually do it in bed or in a chair, and they forget you. There's a little bit of push, like I can move my arm back here. And sometimes if you're doing your stretching exercises, people go up, they go out, they go down, but you need to be sitting up to be able to, roll your shoulder back a little bit. Same thing with the hips. You have to lay on your side to do the back of the hips. We have a book in skincare and different books that explain all these, or you can talk to your therapist about doing these exercises. If you might have your big binder from your rehabilitation, and they usually have a section on that on how to do those properly. Um, Again, there's a question here about, I'm going to go back a little bit to the UTI thing. There's a question about methamphetamine hipurate. I'm sure I'm not saying it quite correctly. We used to use this all the time, and it comes in, it comes out. Again, talk to your healthcare professional. We used to just now I'm talking about years and years and years ago. You just got put on it to help avoid urinary tract infections. But we're so much better at avoiding urinary tract infections with the way we catheterize now, with clean techniques that we're using. We know so much more, so we don't do that as a routine anymore. So a lot of people have a lot of faith in that. Again, it might be the right thing for you. It might not be the right thing for you as a particular individual. So talk to your healthcare professional. They're going to look to see if that is going to interfere with any of your other medications. They're going to look to see if you have a medical problem that's going to affect differently. It might, some medications affect different medications in different ways. And so we have to check into all that. We have computers now. All you have to do is talk to your doctor, ask if that would be okay, if that would be the right drug for you to take, why or why not. You're just fact finding, just getting some information. And then they can just type it into their computer and all the contraindications will come up. So it's kind of a simple thing to do. It's not like you have to go back into a book and dig through all this information. It's like a 3-minute process and boom, they know what it is. So here's somebody who they're quadriplegic with no caregiver service. They have developed lymphedema in their legs. And what's a good recommendation for home treatment? Is there equipment to help me with range of motion overall? Well, I just talked about the loops. That can be helpful. With lymphedema, you might not be able to use the loops right away because that might cut into the edema because the loops are only they're about a little wider than an inch. And if you're trying to lift a leg that's full of fluid with that, it's going to press into there. It could cut and you could leak fluid. So you might not want to use the loops now, but you might want to think about that later. There are some leg exercisers that are automatic. They kind of do a slight range of motion. They're not going to be as extensive as if somebody's moving that leg for you, but you might want to talk to your healthcare professional about that. You might want to talk about if there's any I don't know how bad the lymphedema is. So some people just have edema and they use the TED hose and the pressure, the boots that have the pressure that provide pressure that rolls up your leg. So that helps the fluid go up. I don't know about any of these for your particular case of lymphedema. If it's very, very severe, you might be able to use some of these, or this might not be appropriate. I'm just running through the whole list so that you can talk to your healthcare professional to see what would be the right treatment for you. But those would be some suggestions that you could go and you could talk to a person about that. Would it be appropriate for you to put your legs up on a pillow at night? So, or some kind of bolster to, help that fluid slide down. It's going to have to be higher than your heart. Again, talk to your healthcare professional, especially with lymphedema. That fluid might move, but it might move to the small of your back. And so you have to check that. That's where it sometimes collects there. And then you've got problem because now it's in your abdomen and then you've got too much pressure in your abdomen. And so anyway, I'm just trying to think of all the different kinds of things that you can do. The more you have your legs dependent, the more edema is going to be. So take some rest breaks during the day and get into bed. Put your legs at least even with your heart. So if you're laying in bed, that gives it's hard. It's easy for blood and fluid to go down your body. It's a little bit harder to pump it back up, especially if you don't have that movement in your legs. So talk to your healthcare professional. There's a lot of options out there, and they will have a solution for you. I am thinking about this is just a kind of a wild thought that entered my mind. Sometimes women who have mastectomies get a lot of lymphedema in their arm on the side where their mastectomy was. And they have a sleeve pump that they wear. There's these sleeve pumps that you can get for your legs as well. um, you know, any part of the body, that any extremity, you can get those. So talk to your healthcare professional about what's going to be, because there is treatment for this, Janet. I just don't know which is the right treatment for you because I don't know you. And but I can give you hints of, no matter what I say, I always tell people talk to your healthcare professional because we're also very, very different. And I like to use the example that sometimes, people have an appendectomy. Now, this has nothing to do with your question, but sometimes people have an appendectomy and the surgeon knows where to make the incision and they know where the appendix is, so they can go in there and get it. Sometimes they go in there and it's like 2 inches away from where it should be. We're all a little bit different. You can have a head injury or spinal cord injury on the same day from the same cause, and you're the same age and exactly the same as somebody you know, but they're completely different. This just because that's the way our bodies are. Our faces are all a little bit different. The insides of our bodies are just a little bit different. So, and how we react to things can be a little bit different. Um, Here we have Stephen again. He says taking broad spectrum antibiotics can cause C. diff infections, which can be deadly. Yes, they can. That's why you want to stay away from them. At the first sign of diarrhea, I get it checked. I waited and became septic and almost died. Yes. C. diff is diarrhea. It's a bacteria that is in the gets in the bowel, and it because you're on antibiotics, and it can come from broad spectrum antibiotics. It more frequently does because again, it's wiping out all the flora in your body. Often good flora goes along with bad bacteria that's in the flora of your body. And so that's what happens. So when you're taking antibiotics, oftentimes if people have problems with diarrhea with antibiotics, even with a low level antibiotics, you can get this thing called C. diff. It's a form of diarrhea and it just comes and comes and comes and comes. It has a particular smell to it. So if you've had C. diff before, you know you can kind of smell it. Still, this Stephen is correct. Get it tested. But with the diarrhea, that often happens because antibiotics wipe out the flora in the bowel. So we will often tell people to eat some yogurt with their uh, antibiotics. Some people, healthcare professionals will recommend taking a probiotic with their antibiotic. Now, you see a lot about probiotics on the internet. You see a lot about it on TV. Oh, get this probiotic because it's going to make you feel so much better. And, your bowels are going to move and it's going to be so fabulous. Some probiotics are not meant to be taken for a lifetime. So be sure and check with what you're getting because you might be messing yourself up by helping yourself by taking this probiotic. So always check with your healthcare professional to see what the right treatment is. So that C. diff is a very, very difficult thing. Again, this is kind of a renaissance period that we're having in healthcare, and people recognize it a lot more than they used to even in the hospital, even healthcare professionals. When it first became a thing, people, it was all new and kind of novel. So we're getting much better at treating it. We're getting much better at recognizing it. And people know the importance of treating that. So again, I say, good for healthcare. Yay, healthcare team. Okay. Yes. No. Yes, somebody's talking about the methamphetamine. Again, it's underprescribed and it works to kill all microbes. But again, it kills all microbes. So it might not be the thing. I'm not dismissing it. I'm just saying it's not for every single person. You need to check with your healthcare professional. Um, so anyway, those are just some of the questions that are there now. If we get some more questions, then we'll talk about those. Let me check the other place for immediate questions here because there's a couple of different ways. Let me having trouble scrolling. There we go. Okay. So what are some of the other things that people have been wondering about? Hmm. Stress and disabilities. Um, this is something that I was talking about earlier, kind of sort of in a roundabout way, but I was talking about it earlier in that whenever you have a catastrophic change in your life, and it can be paralysis, it can be a heart attack, it can be anything that's really huge. We're always worried about our mortality first, rightly so. We're human beings. That's the way our minds work. We want to keep the body going. But it's a lot of stress, ongoing stress when you have paralysis, and what I will remind you of or put out a little warning in your head is you think you got it all figured out. Everything's going along just great. Things are going just wonderful. And then something happens and you're kind of like back to square one. And it could be very, very frustrating. as life is often frustrating. You're having a really great day, you got a promotion at work, oh, you found out you're having a baby, you're having this most wonderful day, and then boom, something happens. Life has its ups and downs. We have to learn how to live with those. And for some people, the ups and downs are a lot more extreme than maybe for other people. But when it's your problem, it's the worst problem. So, in looking at the issues about UTIs, everybody's very worried about UTIs, and rightly so. But you have to think about, and people are thinking about, what can I do? What can I do to help myself? And that's an important place to be. But it's important that, you strive to deal with the world that you're in, and be sure and have somebody that you can talk to that will help. There's a thing that's called chronic sorrow, and it was developed for really in the world of pediatrics with individuals who were parents of children who it just seemed like, they would just be doing something and everything would be fine, and then something else would happen. And most of the time it would be in developmental stages, but it's really happens to just anybody. And you don't even have to be paralyzed. It can just happen to anybody. So, you have something happen and it's just horrible. And then you get going and everything's going just fine. And then you find out, oh, I can't go back to work. Gee, I was planning to go back to work. How am I going to support myself? So, it's like the snowball effect just keeps going. In the world of pediatric, they would use the example like, okay, I got my child's in school and things are going really great. And now I have a daughter and all the little girls are now in ballet class, but my daughter can't go. Well, can you talk to the ballet teacher? Can there be some adaptions for her doing ballet in her wheelchair? A lot of people will work with you for that, with that kind of thing. Or if you have a little boy, oh, it's time for, I don't know, Little League, and my son can't go. So there's all these things that, life problems they confront us all. But, when you have so many one after another, so be sure you have some kind of resource, somebody who's with you, somebody who can help you. It might be somebody outside of your family. So sometimes people are like, oh, I don't need to go to a mental health specialist. I don't need to go to a counselor. But, we a lot of us do need to go sometime when we're facing these trials and tribulations of, making it our way through life. It can be quite complicated. So sometimes people go not because they have an immediate problem, but they can help you get some thoughts and some ideas for how to deal with situations that might come up if you deal with somebody who's, trying to take charge of you, trying to kind of overrun your privileges or something, and how can you deal with these situations? So they give you some examples of, if this happens, here are some things to try and kind of prepare you for different events and different things. So, these are all things that are really important that you might need to know. Some things about musculoskeletal issues, somebody's feet and ankles are getting stiff and won't straighten much. What can I do? We need to start doing those exercises so that doesn't happen. As I was saying, over time, our body creates movement. You might not sense it because of your paralysis, but your body wants movement. So we have muscles that push and we have muscles that pull. And the muscles that pull are just a little bit stronger. So sometimes you see people like with strokes, they'll have their hand will curl up and their body part usually usually everything goes to the heart. You can think of that's the way contractions go. Everything will go towards the heart. And so, you need to start stretching those out. Now, if they won't straighten out much, it might be contracted. So don't push too hard. Don't be like, oh, I'm going to make this, because, you could break a bone, you could tear a muscle. So you need to talk to somebody about getting those muscles relaxed. There might be some medicine like Botox that they can give you to help stretch those. Sometimes they'll put on a cast and they'll put it on so that so say if your wrist is like this, they'll put it on so that they've just moved it out this much, and then in a while they'll put it on so it moves back, and they'll slowly straighten out those muscles and get them to stretch out. Sometimes surgery is needed to help stretch out those muscles. That's in extreme cases. So there's all different kinds of things you can do, starting out with just some simple exercises, maybe adding some medications, and then working up the healthcare hierarchy as it is. Somebody wants to know about a baclofen pump and the pros and cons, and they're scheduled for a trial. And so that's interesting to me because a lot of baclofen pumps are going without the trial. It used to be everybody had to have a trial, and people would love it so much, and then they turn it off because it was a trial. It wasn't a clinical trial. It wasn't a research trial. It was a trial to see if it would work in this person. Well, they've kind of done away with the trials now. So I'm kind of curious about that. So they want to do a trial. So, try it. They probably just want to see if it works for you as an individual before they go through a surgery. If it doesn't work after you've had the surgery, now you've gone through a surgery, and that's a lot of trouble if it's not going to work. So they want to try that out. Um, so what are the pros and cons? Well, the cons are the pros are that you don't have to take as much medication by mouth to help control your spasticity. And you can give a lot more medication because the pump bathes the spinal cord. The pump doesn't go into the spinal cord, it bathes the spinal cord. So the fluid that the spinal cord is in, it bathes the spinal cord, so you can give a lot more medication. The medication is heavier um, than your spinal fluid. So it stays down in the lower part of your spinal cord. Some people have gotten them up higher. It's usually done in the lower spinal cord, but you can find somebody who can do it up higher. They avoid that because then that's kind of getting up close to where your breathing is. So, they don't want that baclofen to go up where you're breathing because that can slow that. So that's the con. But if you have it low down, it's not going to do that. It used to be that sometimes they would put them in and they would become detached. So the tube that would go into the area around the spinal cord would become detached at that place or detached from the pump, and it would have to be redone. But they fix that now because they suture it. So they suture the tube to the pump, and they suture the tube to the um, to the muscle outside of the spinal canal so that it won't come out. And so they, again, they're correcting these things. So those are the two big things to worry about that. And then also, this person says they're no longer improving. And yes, there's kind of a plateau, and therapy does not go on forever, and so they're 2.5 years out. But you can get into different kinds of therapy programs to do at home. Again, doing that range of motion, getting a standing frame helps a lot of people. They're that you think, well, I can't stand, but they use blocks. And by blocks, I mean like padding. So, like if you're high level, they'll put one on your chest. You might have a band up on your head if you don't have head support. There's trays where you can put your arms if you have problems with your arms, and it blocks your knees and your hips, so your body is standing, and then the weight is going through your body, and that is an important thing to do for your general overall health. Again, if you can get one where you can exercise you while you're standing, that's great. Everybody has, I say everybody, I would say like 98% of the people in the world in the United States have a section in their health policy that says you get 2 weeks of mobility training. Every year, you get 2 weeks of mobility training. Most people just let that go because they say, well, I'm paralyzed. I'm not going to walk. So, hmm, I guess I don't qualify for this. But, mobility training can be massaged into several different things. So I have heard of people going for mobility training to help to learn to turn themselves in bed. I have heard of people going for mobility training to learn to use a device to be able to feed themselves. So if you have some grip, or if you have something that can provide grip, an adapter that can give you grip. And there's a device that kind of hangs on some springs, and some of them are electric, and it will scoop the food and come up. And, if you have a little bit of arm function, it gives you just enough. If you have the spring one, it helps. And so people are using more of these different kinds of treatment. But that how to feed yourself was considered mobility training. Now, the training does not have to be, and it probably will not be inpatient. I just need to let you know that. It does not have to be 2 solid weeks every day for 2 weeks. It could be every Monday until your 2 weeks have been used up. So be sure and use that. People use it for all kinds of things. If you want to try out a new wheelchair, if you want to try out an electric bike, if you want to try out one of these new devices that is the tape that goes down your back that provides electrical stimulation to your spine directly. People are having success with that. You can use these 2 weeks to go into a trial to see if that works for you. And then you have the evidence to take to your insurance company that I went in this trial and this worked. And so it kind of builds your case for getting some of this more expensive, more novel new equipment. And so it can be very helpful. Now, about the device, it's called the ARC EX, the tape that goes down your back. I know that's like low level thinking to call it that, but that's the best description I can do for it. The electrodes have wires that go to an external box that provides the electricity. So there's no surgery. It's just a tape with electrodes that can be placed on the back. And people are having wild successes with this. And it does not work for everybody. I want to be upfront. It does not make you the way you were before your injury, but it might give you a lot more function than you had before, or just enough function than what you had compared before. So I just read a notice a while back. They're rolling this out across the United States, and they have 60 sites now where you can go and have a trial to see if this device works for you. Now, that's not everywhere in the United States, and we've got a big country to cover. But if you go to onwardmedical.com, you can go on their website and find out, get your name on their list, and they'll contact you when it's in your area, I'm sure. So there's all different kinds of things that you can find out about these kinds of things. Um, what are the latest medications for osteoporosis, bone building, and then maintaining? There's a lot of medications that are out there now. It used to be there just were a few. And, we always think of osteoporosis as, oh, that's something that old women get because of the hormone changes. And it's not just old women, it's people with paralysis tend to get osteoporosis, and it comes on really quickly sometimes. So you need to be tested for that to see, you need to have bone density tests if you're a woman, if you're a man, if you're a teen, if you're a child. All the different age groups are affected by this. So it's something, and there's all different kinds of medications. So you can look over the list of medications for osteoporosis. And I wrote about this somewhere, I think in my blog somewhere. I don't remember all the different names of them, but there's a whole list of them. You could just go in and Google medications for osteoporosis, and they will tell you about what they are, what the side effects are. So they're easier to take than they used to be. And there's different kinds. So there will be one that will be right for you. And you'll have a little bit of a choice. But again, talk to your healthcare professional, because when you read the list, you're going to say, oh, I don't want to take that one, but that one might be the right one for you. So, be sure and talk over with somebody who has the information about you so you know what will be the right one for you. And then somebody's asking, is Prolia or other medications being used for SCI for osteoporosis? Yes, there's a lot of different kinds. So, some are shots, some are pills. Some have different restrictions that you have to sit up and you can't lay down for so long after you take the medications. But, there's enough now that you have enough that you can work into your lifestyle and find the one that's going to be the one that's going to work. But it's very important that you do that because, yes, I have had patients that their bones became so brittle that you could very carefully try to lift under their leg to just very gently move their leg and their bone would just break. So you don't want to have a broken bone because treating a broken bone is very easy, except if you have some kind of paralysis, because that could be throughout, somebody falls down and they break their leg. They usually go in, they put in a plate, they screw it above the break, and they screw it in below the break. But if you have osteoporosis, those screws won't fit in anywhere. So it will just be so weak. Then you're on bed rest. You might have to have a cast that you're now having to deal with. You might have a splint or something, and you just want to have that taken care of before that happens. One more question we have, and it's on one of my favorite subjects. Speaking of diarrhea, I love the way it starts already. I like it. Okay, they've been having some unexpected bowel movements, but they have a history of constipation and feeling it even now. The problem is I'm always feeling miserable, bloated, weight gain, and can never totally empty the colon. Um, they're they they're looking for somebody to give them a bowel routine. Unfortunately, I'm not that privileged. My question, can you give me advice on treatment diet that can adequately empty my colon? Um, that depends. I can give you a lot of suggestions, and we have a bowel booklet, which is, I'm sure, going to be popping up because we have a super information specialist. There's a lot of people that work that you don't see that are fabulous that are working behind this. But there's a bowel booklet that we have, and it's fantastic because it goes through all of this. It goes through diets, it goes through fluid intake, it goes through exercise, and exercise helps that bowel shake and not stir. Um, uh, Different kinds of things that you can use. So, do you use a suppository? Do you have a bowel program? And I'm not sure if you actually have a bowel program. If you don't, you need one, it sounds like. And that can be done with, see, there's a management program appears right now. That can be done either with suppositories or if you're using a bowel program and you're finding you're not having successful results, there, besides suppositories, and people use the Ducalax or they use the Magic Bullet. The difference is the Ducalax has a vegetable coating, the Magic Bullet does not. So if you want one that works faster, people will gravitate towards the Magic Bullet. If you want to put in the suppository and then get on the toilet because you want to spend less time on the toilet, people will gravitate towards Ducalax because it takes about 10 minutes for that vegetable coating to dissolve. Something that's very important is you have to put the suppository against the bowel wall. If you have stool in your lower bowel and you just push that suppository up there, it's not going to melt because the stool does not have enough heat. Your body generates heat. Fecal material does not generate heat. So you have to push it up. So you kind of push it up and then kind of take your finger and push it over to the side so it goes up against the bowel wall. If the suppositories are not working, there's a thing called enemies. It's called a mini enema. It is not an enema that flushes out your bowel. Nobody wants to do an enema that flushes out your bowel because it expands the bowel, it flushes it, it doesn't teach the bowel to contract. And you're trying to get your bowel to work naturally. Too many enemas, it expands the bowel and your bowel stops working. So we always avoid the full enema. Now, you go to the emergency room, you have an impaction, they do what they need to do. So, that's not going to do it. But on a continual basis, you cannot do that unless you should not do that unless it's really, really necessary. So that's And then you might need digital stim. Now, if you have a lower level injury, it is you're just going to do manual removal. The suppositories are not going to work. Digital stimulation is not going to work. If you have a higher level injury, then you need to do the suppositories and digital stimulation. And so those are the basic things. If you're having a lot of problems with your bowel program and can't get it regulated, or for whatever reason, some people will opt for the colostomy. Some people love the colostomy. I have seen people die because they had an elective colostomy. They're few and far between, but I put it out there as a warning. Some people want to have the colostomy because they just don't want their caregiver to do that anymore. And I understand that. But you need to make that decision for yourself if you want to do that. It's a big surgery. So you need that kind of thing. Yes, I did suggest enemies for that as well. And um, I'm going to ask our informational specialist if they have the link for onwardmedical.com is the link to that. So, and then the last question here is somebody with a C6 complete quad. He also has a level of gut pain and testing hasn't shown anything. Is getting more nauseated. Recommendations for his discomfort. Well, that could be a lot of things. So it's not unusual for people with high level spinal cord injury to have gallbladder problems. So that might be something to check into. It could be a complication of the bowel program. And again, we have that bowel program booklet, so that helps a lot. Sometimes the bowel with paralysis moves very, very slowly, and we have to think of ways to kind of get that bowel moving, which is why we hype the exercise so much. Um, could be appendicitis. It could be a liver problem. There's a lot of things that are going on in there. So, in the nausea, that really is a problem. You'll know it's a bowel problem. You don't want this to happen. But if he throws up, you see little flecks of brown in there, his bowel's backing up and he's starting to throw up stool. And that's something a lot of people don't know can happen, but it can. But again, it's one of those way out there things. So making sure that that bowel is empty. I'm a rehabilitation nurse. I'm always going to go to the bladder and the bowel and skin. So making sure that that bowel is appropriately emptied. A lot of people are on an every other day program. Some people need to do a bowel program daily. And you might want to try some of the things if the suppository is not up against the bowel wall, if you're doing digital stimulation. I have yet to meet anyone who said to me, "Oh, I was so happy when they taught me how to do a bowel program. I've been waiting for that my whole life." Nobody wants to do the bowel program. So when you do something you don't want to do, what do? You get in and you get out fast. So a lot of people will not maybe push the suppository up far enough. Maybe they'll push it into stool. Maybe they won't put it up against the bowel wall. When they go to do the digital stim, they go and they do that as fast as they can because they think that that's going to get them faster. When you do it very, very quickly, that tightens the sphincter and it slows the bowel. So a lot of people get in and they do that digital stim and they move as fast as they can because they want to get in and out and they think that they are helping doing it that way, but they've actually made it a bit more complicated. So you want to go in and you want to do a well-gloved, um, well lubricated, because you're gonna spend some time in there. And by time I mean like a minute, maybe. And that's a long time compared to the way some people do it. I mean, they're in and out in under 10 seconds. But the idea is to do it very slowly, very gently, so that you relax that inner sphincter. If he's not sitting up to do his bowel program, it's harder to evacuate the full bowel um, when you're laying in bed. If you lay on the left side, that's helpful. But if you can get him sitting up, and you can't just do that like suddenly one day, if you haven't done it on a commode chair or something, you need to get the equipment and you need to learn to transfer. And So mobility training, learn to do that bow program sitting up. C6 complete, he'll need like a higher level. You can get commode chairs that slide right over the toilet so that you can do the bow program and then just flush and you're done, which is quite nice. You don't have that big cleanup to do. So there's all kinds of things, but all these are suggestions in that bowel booklet, but it can be anything in the abdomen that's causing it, maybe a stomach ulcer. A lot of people who have paralysis will develop a stomach ulcer just from the stress and tension of, I want a glass of water. I have to ask somebody. I can't pick it up from over there. It's just a lot of stress and fear of what's going to happen next until you really get, used to the whole situation. And it just takes some time and different things happen and pop up. So, with that, I hope that I've given some helpful advice today. I always appreciate being with you, and I hope you stay warm.